Hi, my name is Dr. Pritika Singh. I'm a cardio physiotherapist and a maternity exercise specialist. I've been working in this field from the past 11 years. I would like to thank BabyChakra for giving me this opportunity to speak to you about the postpartum exercises for the first 40 days. The first 40 days is one of the most important periods for the mother as well as the child. On one hand, the child is acclimatizing to the new world that he's being brought into, whereas the mother is recovering from the marathon that she has just run, which is labor. During a pregnancy, very often we tell our patients that actually going through labor is as strenuous as running a 41, 42 kilometer, 21 kilometer marathon. Your body undergoes gradually the changes that the body has undergone are actually put to use, are actually strained out to their limits in labor. Now, when you have gone through that, when you have that added responsibility of a baby, when you have to lactate, when you have to breastfeed, while doing all that, how do you recover bodily? That is what we specialize in. In maternity physiotherapy, in maternity exercises, it is very often, and it's actually a myth, that you cannot exercise very early, that you cannot exercise at all, that the 40 days are for you to rest. Of course, they are for you to rest, but they are for your body to rest and be in its optimum capacity. Considering all the strenuous activities that are happening around you, you are taking care of a baby, not sleeping, all of that. There is also an internal recovery that you are making. That internal recovery needs to be adjusted along with exercises. Whether it is your spine, whether it is your stomach, whether it is your legs, whether it is your mental health, all these phases need to be recovered. And I think exercise plays a very, very important role in that. That is where we come in, that is where we tell the patient that okay, if you are a vaginal delivery patient, then after 2 weeks of resting, completely resting, you can start your exercises. If you are a cesarean section patient, then you need your scar to recover. You need at least the base layer of the 7 layers that are cut through in cesarean sections to recover till you can start your exercises. And that time would be around 4 weeks. So the 40 days, the idea of 40 days is basically including around 4 weeks of time for the mother to rest and recover bodily. But nowhere is it a compulsion that you cannot exercise during that. And that is what we are preaching. We are preaching that if you have a vaginal delivery and your scars have healed, if you had an episiotomy and you had a scar at your vaginal area during the delivery, then as soon as that recovers, which hardly takes a week, and in the second week of your pregnancy, you can start your exercise. Now, what those exercises would be? Those exercises would basically be mobility exercises, very light mobility exercises coupled with strengthening exercises. Because your muscles have gone through that stretch of having a baby, your stomach muscles, your abdominal muscles have gone through that stretch of the weight gain, of the baby, of the a lot of people almost everybody feels the diastasis recti, and a lot of people have a lifelong history of the diastasis recti not going. All of that needs, if done at the right time, if very strategically approached, can be avoided. All of those later complications, a lot of the women have complications of low-lying uterus and uterine prolapse. All of that can be recovered if postpartum you start exercising at the right time, the right way, and of course you should always have professional help for that. For the first 40 days, on a general note, if I would tell you, of course, every person's needs are different. Some people, because of some complications, undergo some different kind of needs, but most of the people who undergo vaginal delivery have a basic set of exercises that are your leg raises, that are your lower, your hamstring exercises, your quads exercises, your bridging exercises, upper body exercises. All these exercises can be done in the second week of a vaginal delivery, and actually post third week, once you've completed your third week, even before those 40 days are complete, you can start those exercises. So that is a general idea of the postnatal exercises in 40 days. The exercise that I've told you would remain same for both C-section and vaginal delivery, but the timing at what you can start varies. Today, thankfully, in our science has established itself so much that even cesarean section patients are not immobile. The second day of delivery, they are told to stand up, go take a bath. Their scars are, their dressings are changed, and as soon as that is done, the scar is on the road to recovery. So light. The only two things that we need to keep in mind are the exercises need to be light. The exercise need to be specific to your body, considering the complication that you've gone through. And if you've had an uncomplicated delivery, then you can just straight away go ahead with your lower body exercises, bridging exercises, and not strenuous abs exercises, but of course you can do isometric exercises in which you can strengthen your stomach muscles, placing a pillow or your hand at your back and pressing down. Your isometric back exercises, all of them you can begin. I would also like to take up a few questions that we have received from our viewers. So, first of all, the question that came and which was quite rightly asked, it's like a generalized question that we framed is, when can I exercise post vaginal delivery and what exercises? So, post vaginal delivery, you can exercise after the second week, after you've completed your 2 weeks of recovery, and then you can start with your back exercises, your leg exercises, and of course upper body exercises. Upper body exercises are very underrated when we talk about recovery post delivery. Nobody talks about it much, but they are one of the most important exercises because you're lactating at that time. And because of lactation and because of 90% of the people not following the proper posture during lactation, a lot of people develop cervical issues, upper back issues. So upper body exercises, keeping your hands like this, looking up, looking right, cervical exercises, shoulder exercises, all these exercises need to be inculcated in your routine so that while you are delivered, as soon as you delivered and you are lactating, you don't develop long-term upper back problems, long-term cervical issues. Another question that we get very often is exercises to support postpartum weight loss. Now, weight loss and exercising postpartum are not the same thing. Weight loss is a different genre when it comes to postpartum exercises. I think, and I think it's very valid for the initial 2 months, 3 months, even 4 months, that weight loss should not be your goal. Your goal should be to stay healthy. Your goal should be to successfully achieve breastfeeding, lactation, and most importantly, your goal should be the health of yourself and your baby. So I don't think anybody should approach the road to weight loss before at least 4 months postpartum, because before that, and if you do, you get into fad diets, you think you should go for jogging, and you think you should hit the gym. I think you would overwork your body, because anyways lactation draws everything out of you. It's a tiring process, and those initial 4 months you are also learning how to go through it. So after that time, you can very well start your postpartum journey. And postpartum is your weight loss journey, and weight loss needs to be for the whole body. There is no one exercise that you can do that you can lose tummy fat or upper arm fat. So it's actually a whole body thing. So I think a holistic exercise like walking, something like that would really work. So another question that we've been asked are postpartum C-section precautions. Those are definitely scar related. You have to avoid lifting up heavy objects, because that can lead to herniations, because already the layers of your skin are open. And of course, you have to take care of your scar. Those are the two most important things. Anything strenuous you should not do. That's basically a general idea. There's another question which said that I had a vaginal stitch 2 months back and experienced pain when practicing yoga and walking for long. How can I manage that? So vaginal stitch can be because of many reasons. It's not necessary that it has to be postpartum, but as I think after 2 weeks the vaginal stitch for sure has recovered. If you are developing pain after that, then probably you've developed an infection in your vaginal stitch, or there is some sort of pressure that you've applied which has put some sort of friction there. So you would definitely have to go for a vaginal exam, and apart from that you will have to immediately stop doing any strenuous activity, the yoga that you are doing, and show it to your gynae and have a checkup. And if everything is fine, then you can probably ease out on the exercises where you feel that you are feeling most pressure. So all those exercises you can ease out on and gradually strengthen it, because anyway it's a area that has gone through so much strain. So you can gradually train it. Maybe you're all putting too much pressure too soon on it. So that could be one of the things. Another question is that I had twin pregnancies and I feel very tired and weak when I walk. Are there any other exercises which I can keep, which can keep me healthy? So of course there are a lot of exercises. Of course you can do a lot of exercises while lying in bed. So you can do your Kegel exercises, you can do your leg exercises, hamstring strengthening, quadricep strengthening, you can do your bridging exercises. You can do all of that, but a very important point would be that if you are constantly feeling tired during walking, that means you are not feeding properly. That means your body doesn't have initial nutrition, because walking is one of our most fundamental features of the human body, and that require the kind of energy that requires would be any day very mild as compared to a strenuous gym workout. So if you are feeling very weak, then it's probably the nutrition, and that needs to be managed. So our takeaway from the whole thing is going to be that we would suggest that within the first 40 days, you need to exercise from the second week itself if you've had a normal delivery, and that